Good afternoon, everyone. Welcome to our member cafe. We're just going to give it just a moment for everybody to get into our event. So give us just 1 minute. Okay, we're going to give just a minute longer to let everybody get joined in. Thank you for joining us today. All right. So welcome to our member cafe. Thank you for joining us. My name is Beth Brooks. I'm the member engagement specialist lead here at Partners. Joining us today on our panel is our member engagement director, Allison Crotty. We also have member engagement specialist, Lindsay Green, Maria Shannon, who is new, and we are excited for her that she has joined us, and Shirley Moore. So Abby, can you put up our first poll? So if everyone could just enter in their preferred language. And if anyone needs Spanish interpretation, we have that available. Abby, do we have the results? Okay, all right. Very good. We also are offering this in closed caption. So if you need that, that is available. If you don't need that, you can hover over the live transcript and then click hide subtitles, and that will take away the subtitles. All right, Abby, do you want to go ahead and do the next polls? And as you are completing those polls for us, I'll just go over a few housekeeping items. So today, please do not share any personal information during this call. Partner staff is available after the call for individual issues that you may want to discuss, and we also can schedule some time one-on-one. This meeting is being recorded, and the PowerPoint slides will be available on our website at www.partnersbhm.org. So as we move along today, please feel free to put any questions into our Q&A feature, and we will go through the information that we want to share with you today, and then we will moderate the questions at the end. And then at the end, you may also raise your hand and we can open your mic up and you can speak your question or voice any concerns that you may have. Very good. All right. Okay. So Abby, whenever you are ready to share the screen. And we'll go to that first slide about partners. So Partners Health Management is an insurance plan for those who receive Medicaid and state-funded services or state-funded funds that manages providers and ensures access to care for people who need mental health, substance use disorder, and intellectual and or developmental disabilities and traumatic brain injury services. We are recognized across North Carolina for our community model and our commitment to the counties and families we serve. We provide advocacy, support, and education for members and families who receive services in our counties. And we have a 24/7 crisis call center for behavioral health concerns or to access mobile crisis. And that number is 1-888-235-HOPE or 4673. Our official name is Partners Health Management, but we go by Partners. You may remember that counties had mental health departments years ago. They have changed to become local management entities or managed care organizations called LME MCOs. You may also hear people call Partners a health plan. All of these are true. You can think of Partners as part government agency and part insurance company. Partners does not provide treatment services directly to our members. Instead, we make sure those who need treatment can get it through a network of providers who contract with us. All of the money that Partners manages is for serving the behavioral healthcare needs for you and others in our community. The better Partners manages that money, the more services and programs we can provide to our members. Our goal is to improve lives and strengthen communities by focusing on positive outcomes for our members. Next slide, please. So we are excited to welcome some new counties to our service area. Currently, we serve Burke, Catawba, Cleveland, Gaston, Iredell, Lincoln, Rutherford, Surry, and Yadkin counties. Cabarrus, Union, and Stanley counties the transition process will be completed on September 1st, 2021. And Forsyth County is awaiting a decision on its realignment request from the North Carolina Secretary of Health and Human Services. Davie County is the 5th county to request realignment with Partners. And so please send any questions about our county realignment to countyquestions@partnersbhm.org, or you can call toll free at 1-833-589-2184 or visit our website at www.partnersbhm.org/welcome-to-partners for the most up-to-date information. Next slide. So we have some upcoming events welcoming our new counties. The first one that we will have coming up is August the 12th from 6 to 7:30 p.m. And you can go to our website, the www.partnersbhm.org county-realignment, and then the member events to register for these. So the first one is an open house, and it's to get to know our departments and our employees a little bit better, and you'll be able to ask questions. And then The next one will be August 18th from noon to 1:30. And you can go to the same website to register for this event. And this will be about our registry of unmet needs and how to get onto our registry of unmet needs, ask questions if you are coming from one of our new counties into our service area, and you will be able to ask questions and get more information. So please join us for those upcoming events. Next slide. Now I'd like to talk to you about our member engagement team. Our team supports members through empowerment, advocacy, education, and navigation of North Carolina's public behavioral health and IDD healthcare system. Our staff is dedicated to building strong partnerships with our internal departments, providers, external stakeholders, and disability-specific advocacy groups to better serve our members with resources and continuity of care. Next slide. You can contact us through our dedicated phone line, and that number is 704-884-2729, or you can send us an email at memberquestions@partnersbhm.org. You can also keep up with us on our social media platforms. Next slide. So if you do email us, we want you to know that we want to keep your information as safe as possible. This includes through email. So we respond to all of our emails by secured Zix Core email. So if you get a response from us, it will look like this, and you will open the message, and then Abby, go ahead to the next slide. And then your email address will appear there, and you can click the register to register your account, and then enter a password, and keep that password handy because you will need it to open all of our emails. So you'll log in to the Zix Mail and enter your password, and then that way all of your information will be as secure as possible. Next slide. So on our partnersbhm.org website, you can find important information under our member tab. And so that tab, you can access crisis help, find a walk-in center close to you, and access state and national websites that offer help and advocacy for mental health, substance use, and IDD and TBI, and veterans services. You can also search for a provider agency in your area that provides the services you may need or want. The member tab also offers confidential screenings to help you determine if you should seek help. The member education page also offers printable member materials, including our member handbook and our member rights and responsibility page. Please take time to read through these materials and learn about the resources Partners offers. You can also check out our About Us tab and find our Partners calendar for more information about Partners and the new events, trainings, and happenings in our community. We also have our Member Connect, which is our member portal. And then you can go into the member portal, and you can also send and receive secure messages with our member engagement team that way as well. Next slide. So we have contracted with Pix Health, and that is a really neat app that you can download to your phone, and it encourages members to keep up with their mental health. It gives helpful tips to live a healthier lifestyle, daily mood and wellness check-ins. They have screenings, messages. They also have coloring book app, and they have games. So it's a really great way to stay connected in between services. They have a compassionate call center with people who have lived experience. So that also send referrals to us for us to follow up with. So our member engagement team receives those referrals, and we do follow up with members. So you can download it. You can go to www.highpix.com, and then that is a free mobile app for your phone. So we encourage you to sign up and register for the Pix Help app. Next slide. We also have our Aunt Bertha, which is a social care network that connects people seeking help with verified care providers and services in our community. The Aunt Bertha search platform is completely free and open to the public. You enter your zip code and search for a free or reduced cost service like medical care, food, job training, and so much more. So all you have to do is go to our www.partnerslink.auntbertha.com and enter your zip code in and find these resources that are close to you. So who are you going to call? If you are receiving services, please refer to your provider for service questions. They are your first responder in a crisis. For other service help and crisis assistance, call our Access to Care department 24 hours a day, 7 days a week at 1-888-235-HOPE or 4673. If you have a care manager, please call your care manager. And if you are not in services or do not have a care manager, please feel free to call our member engagement line for help with resources and information at 704-884-2729. And again, you can email us at memberquestions@partnersbhm.org. Next slide. So the updates for the Registry of Unmet Needs. The Triad IDD Advisory Board is working to improve awareness and inspire action to address the needs of people with intellectual or developmental disabilities who are waiting for a spot on the innovations waiver. The waiver covers services for people with IDD so they can lead independent lives. So this is an initiative that we support. It's called Too Long to Wait. If you are interested, please go to the North Carolina Innovations Waiver Action Too Long to Wait and learn more at ncwaiveractionsteam.com. So this is our roadmap to the Registry of Unmet Needs. We've created this to give families kind of a visual guide about how to get your loved one on the Registry of Unmet Needs. You can find this on our member tab under resources and printable materials. So please check that out. So if you want to get more information, the first step is to call our Access to Care line and schedule a telephone appointment with our registry and referral team. You may also call our member engagement specialist and we can get you transferred. The NC Innovations is a Medicaid 1915C waiver for people living with intellectual and developmental disabilities who meet certain eligibility criteria. The waiver provides services and supports to help eligible members live independently in the community instead of in an institution or group home. Funds are limited and there is a waiting list called the Registry of Unmet Needs. And please schedule an appointment and get your loved one on this registry. This is also available in Spanish. So if you have a grievance You can, a grievance is a concern or complaint, and it's a way for you to express your dissatisfaction with matters involving partners or providers in its network. You may file a grievance about any matter other than the official action to deny, reduce, suspend, or terminate services. You or anyone else on your behalf may make a complaint. Next slide. How to file a grievance. You can call in to our Access to Care line at 1-888-235-HOPE. You can mail it in to Partners Health Management and Care of Grievances at 901 South New Hope Road, Gastonia, North Carolina 28054. You may email your grievance to grievances@partnersbhm.org, or you can use our feedback form located at www.partnersbhm.org/feedback. Or you can do it in person, and every employee and partners can take your grievance. Each option is confidential and secure. You have the right to not be contacted by partners and not to have your information shared with others involved in the grievance. However, being able to contact you to discuss your concern will help us effectively resolve issues and better serve you. Now I'm going to pass it to Shirley Moore, who's going to tell us more about our human rights committees and other committees that you can be involved in.
Good afternoon, everyone. I'm Shirley, and I just briefly would like to speak with you about our Human Rights Committee, which is one of the internal committees here at Partners. This particular committee works to ensure individuals' rights are being met. It's most important to Partners that we support the rights of our members and ensure that they are treated with respect and with dignity. This particular committee creates processes to discuss, review, and track concerns about possible member rights violations. We ensure that procedures and plans do not violate human rights. We also work to ensure needed services are offered in the partner service area. If anyone in our community is interested in this particular committee, we ask you to contact Keisha Sandich at 704-884-2698 or K Sandich at partnersbhm.org for more information. Keisha is welcoming any interested individuals who would like to join this committee, so we certainly encourage you to make contact with her. Our second committee is our Consumer Family Advisory Committee, better known as CFAC. This committee is a state mandated committee by statute 122C-70, 170. And this committee is, the goal of the committee is to certainly be an advocate for our members in the community, but also to serve as advisors to our partners' health management organization. This is a most important committee to Partners as we help to identify those services that may be needed for our members, if there are any gaps that might be particular to one of our counties. And we're happy to announce that traumatic brain injury has been added to our group of individuals that will be supported and served. And so at this time, we are also seeking members to participate in this committee. If you're interested in knowing more about the committee, please contact me, Shirley Moore, by phone at 704-884-2646 or by email at smoore@partnersbhm.org. I'd also like to just extend a personal hello to two people that are with us today, Tawana and Bob, both of whom are participants on this call, but are very strong advocates for our members. Thank you for extending your hello to me, and hello right back. Have a great day. Thank you.
So stay in touch with us. Keep your contact information updated. Partners may need to contact you about your behavioral health plan. So if you receive Medicaid, contact your local Department of Social Services to update your information. And if you receive state funds, contact Partners at 1-888-235-HOPE. And again, you can email your questions at memberquestions@partnersbhm.org or call us at 704-884-2729. So now we are going to open it up for our questions. So the first question is, when will the transition implementation date be for Forsyth and Davie counties? Allison, would you like to take that one?
Sure. So we're waiting to hear from Department of Health and Human Services when that exact date will be. The expectation is that the announcement will be any day from today. So very soon they'll put out a press release. So just keep connected with North Carolina Department of Health and Human Services, and you can look at their press releases on their website. It's ncdhhs.gov. And we will also have, we put news updates on our website as well. And you could always call and check, but we do expect to hear that soon, and we'll let you know.
Just a reminder, if you have a question that you would like to speak, you can raise your hand and Abby can open your mic. At this time, we don't have any more questions in our Q&A. So please feel free to enter those in to the Q&A. If you don't prefer to speak them, we'll be happy to answer them. If you have any questions or concerns, we'll be happy to answer those as well.
Okay, there's a question.
So will that be for Davie County also? We know Davie just opened their public comment period.
Yes, there is an expectation that we could hear about both of those counties, but we don't know for sure. Nothing has been confirmed. I think similarly, they did that with Stanley. So Stanley was at a more like a premature phase in the development of the county transition, and then the secretary pulled them in to align with the September 1st launch, or joining partners on September 1st, a little sooner in that trajectory. All right, maybe we'll feel free to show your faces and we can have a conversation and ask your questions aloud or in the chat.
Allison, if I could add, our CFAC committee is very excited to conversations with Cabarrus, Stanley, and Union to collaborate to bring our CFACs together. So we've been meeting, and it has been a pleasant, really and truly pleasant opportunity to get to know the members of these counties. And we look forward to getting to know the communities as well. So I just wanted to let our audience know, if you have any questions as it relates to these counties, please feel free to call me as it relates to our Consumer Family Advisory Committee.
I have a question. I'm not sure if you can hear me or not.
Yes, we can. Go. I saw your hand just pop up. Go ahead.
So as we come on with some of the, Union County and some of the newer counties, it looks like Partners has some services that are going to be new to us. So we've got some folks that are pretty excited that this will be a new opportunity. So I'm specifically looking at long-term community supports, because that's not a service that Partners offers. So of course we want to know more about it and have lots of folks that would really be interested. So how can we, I've got the service definition, but how do we find out more about it? I understand that there's, I can see where they could get that service as well as community guide, for example, but how do we make referrals? Where can we get a list of those agencies? Because it's new, it's something we don't have. So there's going to be quite a lot of interest in it because it looks like a really great service. We've never had anything outside of community guide and a speckle of respite. So we're super psyched. Yay.
That is a great opportunity for the newer counties, and we're excited that there'll be more choice for you. Did you see the event that we have scheduled on the 18th? It is at 12 noon to 1:30, and it's for IDD registry of unmet needs, targeted to explaining the services that are available. And you can ask more questions about it. We'll go through those slides. We also can send links to the recordings of the past event that we presented on, actually several that we presented on long-term and community supports. We just did Maria and I did a presentation with ARC and Family Support Network and went over those services with the help of our utilization management and care management teams. But we can set up a time if you want some one-on-one help with that. You said you've already reviewed the service definition. The clinical coverage policy goes into much more depth, and that's on our provider pages on our website. You look up clinical coverage policies, that'll give you more details too, and what it would mean for your family particularly. We could set up some time if the question and answer doesn't help when you attend those events.
Okay.
Does that help?
It does. It does. Thank you.
So we do have a question that's come in. How will CFAC be reorganized with so many counties joining?
At this time, the CFAC is governed by their bylaws. And so with the bylaws, they will establish how those CFAC committees will be organized. And currently we are working along with Cabarrus, Union, and Stanley to review those bylaws and look forward to doing the same with Forsyth and Davie. But the bylaws govern the committee, and these bylaws are established by the members. They're not established by Partners, but by the committee. So this is the way that the membership will organize themselves.
Thank you, Shirley. Does anybody else have a question? Well, please feel free to submit your questions in the question and answer, or raise your hand and we'll be happy to call on you and you can speak your question live. Again, I want to remind everybody that we have 2 upcoming events. They are open to everyone. We're welcoming our new counties in, but it's also an opportunity to hear more from each of our departments. So everybody is welcome. The next one will be our member and community open house. It is August 12th from 6 to 7:30. Please register for that. There'll be an opportunity for you to ask questions, and then talk about any concerns that you may have, and we can address those. Also, on August 18th from noon to 1:30, we will be presenting on the registry of unmet needs. Again, you'll have the opportunity to ask more questions of our care management team. So we hope you'll register for that and join us for these 2 upcoming events. So we would also like to hear about anything that you would like to learn more about. So if there's anything that we can present in our upcoming member cafes, we would love to hear your feedback on that, and know what we can offer in the future that would be helpful. So we did have another question come in, and it's any updates from DHHS on how they will divide the Cardinal fund balance?
We do not have any information on that to share at this time. We do not. I'd offer it to you if we had it, but we do not have that. And just stay tuned. I know there's a lot of work going on between Cardinal and Partners right now, and both sides, and everybody's cooperated so well, and we're just making sure that it's as seamless as possible for members, and we want to do the most that we can for our members and make sure that it's fair. So everybody's working hard to bring that to fruition. And if you have ideas about speakers you would like us to showcase, something that we plan to do going forward, after we do a lot more orientation for counties joining us, we're going to do regular service updates and overviews for all types of services, for TBI, mental health, substance use, and IDD. So we'll have like a monthly service overview for everyone that'll be continue, and then we'll have some recorded versions, of course, that you can see. But and we're beefing up our website every day, and we welcome any suggestions for content, for operability. You know, what make it better, more user friendly if you find it not. But we've had some people tell us that they found it quite easy to move around and find the information. So, but we are very open to suggestions and love to hear from you.
So please send us more questions. We are available till 2. If we don't get any more, then we will give you some of your time back today. But again, we have very much appreciated you joining us today to hear the information that we've shared. We have enjoyed answering your questions. We would love to hear more feedback from you. At the end of this presentation, a survey will pop up, and we ask you to please fill out that survey. Abby, am I right that there is a place for people to get signed up for our newsletters? Is that on that survey?
Yes.
So you can subscribe to our news and information emails that we send out. So please do that. That keeps you in the know about what is going on with partners. So if no one else has any more questions, we'll give you back some of your time today. Again, thank you so much for joining us. And then we will see you next time, next month. Second Tuesday of the month from 1 to 2. Hope you all have a great day and stay healthy.
Bye, everyone.